Okay, I'm going to be your nurse practitioner student today. We're going to do an abdominal exam. I'm going to have your knees up just to help relax the muscles in your abdomen. We're going to start with just inspecting the skin. There's no stry, there's no bruising, there's no surgical scars, no rash, no bulging, no masses present. The skin is done. The contour is symmetrical. It's not protuberant. It's not scaphoid. It's flat. If it was distended, you could have obstruction or liver disease or fluid. We're going to move into, I'm just going to take a listen. We should be hearing normal bowel sounds are 5 to 30 a minute. High pitch would be significant of obstruction. Low, a decrease would be slow motility. Should hear some gurgling of the belly. If bowel sounds were absent, it would also be significant of obstruction or no motility. It's normal timpani bowel sounds in all 4 quadrants. I'm going to start with a percussion. I'm going to start in the bottom right. There should be no dullness, which is significant of fluid, stool, organ. I'm going to go into palpation. At first we notice there's no pulsations of the aorta or peristalsis. We'll start in the right lower quadrant with a light touch. Let me know if there's any tenderness.
No.
We'll take note of patient's facial expressions. Looking for any hernias, any masses, lesions. We're going to go a little deeper. Go ahead and breathe out and relax. So there's no guarding with the muscles. Again, feeling for masses, lesions, symmetry. Perfect. Contour, symmetrical, no masses, no hernias, no pulsatile areas. I'm going to go ahead and just take a listen to the aorta. Should be able to feel the aorta. Should be no greater than 3 centimeters in width. Should not be pulsatile or bulging, which would be aneurysms or rupture, or at risk for rupture. And take a listen, make sure there's no bruise. No bruise noted. We'll then move off to the renal arteries again, checking for any swishing or bruise. Comparing side to side, making sure there's no dampening. Moving into iliac. No bruise noted. And then into the femoral. No bruise. And go ahead and then auscultate the liver. a big breath in and blow it out. One more. Go ahead and breathe normal, making sure there's no rub, which would be with enlargement. Again, we're going to take a listen to the spleen, just under the costal margin. Again, making sure there's no splenic rub, which would be significant of enlargement of the spleen, which can happen in infections and trauma. Take a big breath in and out. Perfect, no rub. And then I'm gonna percuss the liver. We're gonna start mid-axillary, probably about the sixth rib up, sorry, and just normally. Noting that the margins are, I'm going to use our metric, it's about 7 centimeters. Should be in between 4 to 8. Anything greater than that would be enlargement of the liver with cirrhosis, liver disease, hepatitis. Again, we're going to do the same on the spleen. We're going to take anterior axillary, mid-axillary. This is Traub's area. We're going to go to the bottom of the costal margin. Go ahead and just relax. I'm just going to percuss. Should just be a tympany, no dull signs. Again, I'm going to have you take a big breath in and hold it. No dullness noted. Go ahead and relax, which means no spleen enlargement. I'm just going to palpate. You go ahead and relax. I'm going to grab behind and go in. Take a big breath in and relax. Blow it out. Cannot palpate the spleen, which is normal. While I'm here, I'm just going to feel for the kidney. Take a big breath in and blow it out. It'll help relax muscles, helps palpation. Perfect. No palpation of spleen or kidney on that side. On this side, excuse me, we're going to do a palpation of the liver. You can start kind of down low. Try and breathe in and out. Blow out to relax. Take a big breath in and blow it out. There, you can feel the liver about 1 centimeter down off the costal ridge, smooth, non-tender. The other way is to go ahead from kind of the side and have a hooking. Take a big breath in and blow it out. Just to get the rectus to relax a little bit. Good. No enlargement of the liver. If you don't mind sitting up just for a second. I'm just gonna bang back here. Any tenderness with that?
No.
Probably about the 10th or 12th rib, posterior ear. You can check for flank pain or CVA tenderness, significant of pylo or nephrolithiasis. Good, go ahead and relax. I'm just gonna hold on this side, you go ahead and relax. I'm just gonna push in, just checking for fluid or ascites. Same thing, hold this side, checking for a wave of fluid. No ascites noted. I'm then going to, I'm just gonna palpate down here at McBurney's on the inside, ruling out appendicitis. We can go to Rovig sign on the left side and see if there's any tenderness on the right lower quadrant or rebound tenderness to rule out appendicitis. And then up here mid-gastric area, go ahead and take a big breath in and blow it out. We're going to check Murphy's point, rule out gallbladder, cholelithiasis, and even further to the right, you could check for a little pancreatitis. Well, now go ahead and lift your leg up. Go ahead and flex it towards your chest. That's the psoas muscle. Go ahead and relax. Inflamed with appendicitis. I'm going to pick up your leg. You can relax. We're going to do kind of an internal rotation of the hip or an obturator sign, again with appendicitis. I think that's it.